Hello, my name is Patrick Duggan from Managing Aggression and Violence Consultancy. A couple of weeks ago I made my first video about the very important issue of prone or face down restraint. This practice was just a regular practice in NHS trusts. It's becoming less so now. I feel it's an important issue because I think now there are alternatives to this position. And it's not necessarily because of the risks of positional asphyxia from face down restraint. Anybody that's been working in mental health services over the last few years and has undergone training in prevention and management of violence and aggression will know that there has been roughly about 13 deaths reported in mental health hospitals over the last 15 years in relation to prone or face down restraint. Undoubtedly, face down restraint does increase the risks of positional asphyxia, particularly if people are overweight or if they've got some physical medical problem. However, staff that have undergone training courses in the NHS for many years have known about good practice in relation to prone restraint. They know not to put pressure on the head, the neck, the shoulders or the back at any time. Obviously that would restrict the breathing. However, the risks still remain there. And so, you know, the Department of Health guidance from 2014, April 2014, positive and proactive care, reducing the need for restrictive interventions, sets a challenge for trusts and PMVA providers. Section 70 of this report says there should be no planned face down restraint on any surface, not just the floor. So I think the challenge is out there. It seems to me that a number of trusts have adopted using supine or putting people on the back, which is undoubtedly safer, but it has its own risks. There's the risk that it's not as easy to breathe as if you were standing up. It's not dignified if you're a female service user or patient. And more importantly, there's the risk to staff. If they approach, they can get kicked. The NFPS, National Federation of Personal Safety, has a recovery position hold where they can hold people safely on the ground. With this hold, the chest wall is totally off the ground, and so people have no restriction of breathing at all. It's also a very relaxed and dignified position. If on the rare circumstances people have to be held on the ground because of extreme violence and there's a need to give an injection can be given safely. The staff can then reassure the patient that you're in recovery now, you can relax now. Staff can also look at the skin colour. I refreshed on this technique a few weeks ago and it reinforced the importance of putting this out there and advising people, telling people about it. I've also delivered this training to a number of nursing agencies for staff working into mental health hospitals and learning disability hospitals throughout the country. It's been very, very well received. People have thought it's a real advance compared to prone face down restraint, and they've also thought that it is safer than the turning people over and putting them into the supine or on the back for the reasons explained. I think the recovery position hold allows the patient, some dignity there. I don't think there's the hangover from restraint because it is more of a dignified position and people can breathe. They don't have to fight that much against it. They can see that nurses and care staff really do care for them, and they want to do it for the minimum amount of time. So I think it will cut down on struggling. At a time when a person's ready to stand up, then staff can just simply let go and help and get the person up on their own or assist them to stand. If you're interested in knowing more about the recovery hold position on the ground or any other aspects of training in relation to PMVA, positive handling in schools, I'd be very pleased to hear from you. If you want to ask any questions about the technique or anything, please get in contact. So my name is Patrick Duggan. I can be contacted on my email, which is mavconsultancy, mavconsultancy1@gmail.com, or via my website, which is mavconsultancy.co.uk. Thank you for watching. Hope you have a good day then. Thanks. Bye.